Have you ever had any of your patients come to you asking about the use of such things as St. John's wort for their depression, soy isoflavones for their hot flashes, or coenzyme Q10 because they've heard that their cholesterol medication can be robbing them of this nutrition? If you've heard such questions or comments from your patients and have wondered about their efficacy, then you're going to want to pay special attention to this module. Probably one of the most misunderstood and most underutilized areas of medicine today is complementary and alternative medicine, also known as CAM, and sometimes called natural medicine. One of the reasons for this is because mainstream medicine really hasn't grasped onto the literature and the studies behind this form of medicine. CAM involves the use of natural substances to treat and prevent disease. It's generally more effective in preventative medicine with goals such as reducing heart disease, cancer, immune complaints, diabetes, menopausal symptoms, chronic inflammation, depression, and etc., than it is for the acute conditions such as pain, fever, injury, and infectious diseases. Although CAM can be useful for these conditions too, it works via multiple health endpoints rather than merely one or two. For instance, fish oil omega-3 fats and coenzyme Q10 work by improving entire cardiovascular health rather than just focusing on treating only hypertension or only cholesterol. As a result, we say that CAM complements the body, meaning it works with the body to improve health, thereby reducing risk of disease. Another aspect of CAM is that its primary focus is on preventing disease before it manifests, rather than treating the disease after the fact. This is achieved through improving health generally, rather than focusing on one specific symptom. This is what is meant by the statement that CAM is preventative medicine. Finally, CAM can be used also with conventional allopathic medicine to either reduce side effects, for instance, CoQ10 reduces some of the toxicities of statin medications, or to improve effectiveness, such as coenzyme Q10 enhancing hypotensive effects of antihypertension drugs. And when you combine CAM with allopathic conventional medicine, it's known as integrative medicine. However, sometimes there can be increased risks of side effects, such as combining prescription antidepressants and St. John's wort, which could result in serotonin syndrome. Sometimes the combination can result in a reduction in efficacy, such as soy isoflavones, blocking access to estrogen receptors, rendering hormone replacement therapy less effective, or St. John's wort inducing liver enzymes that metabolize oral contraceptives, rendering them ineffective. In such cases, it's not a good idea to combine CAM with allopathic medicine. In this module, you will develop an understanding of both minute dose medicine and naturopathic medicine. You'll grasp the principles of herbal medicines, understand the value of phytonutrients and what is meant by a food supplement. You will also learn what doses of certain vitamins and nutraceuticals may be dangerous, as well as understanding herb-drug interactions and which should be used with caution together. And to wrap up this module, you'll learn the indications and contraindications of which nutraceuticals to use for which medical conditions through both didactic and practical application with case studies using natural medicines and homeopathy. Now there's 4 sections you'll need to complete. The first section is the bulk of your program, which includes required readings in the form of PDFs, PowerPoint presentations, and outside links to important articles. Throughout this program, you'll be able to post questions to the faculty through the module form and communicate with your classmates. You will then move on to the case study sections, which includes quizzes to test your understanding of the material and to experience real-life applications. Following the case studies, you'll move on to your final examination. Now, even though the final exam is an open book examination, we encourage you to think through the process rather than just find the answer and move ahead. After all, when you complete this module or any of our modules or fellowship programs, we want you to leave with a real understanding of how to apply the knowledge that you've just received. Lastly, to end this program, we ask that you fill out a short survey to give us your feedback on the overall module. You can then click on Certificate of Completion, where you'll be able to download your certificate. We hope you enjoyed this module, and remember, if at any time you get stuck in a section, have any questions that you just can't get answered through the form, or have any other questions or concerns whatsoever, you can always get a hold of a staff member through our email at info@theiifim.com. We want this experience to be a great experience for you and one that you can translate to your patients as well as to your colleagues. So good luck on your studies and enjoy the learning process.